So today we're going to go over a nice and nifty tool that we have in case our patient has an IV and they need to get up, go to the restroom for a procedure, whatever it is. So in this case here, the cathlon is taped to the table, but I'm going to pretend that this is my patient. And so the patient has this IV extension tubing, and then they also have their IV line hooked up to it. Now, if this needs to be disconnected, I can most certainly do that. I just need to make sure that my IV fluids or my pump are stopped so that I don't lose any medication. But then if I unscrew this, I have now freed the patient and they can go wherever they need to go. But the point I want to make today is that this part of the Luer lock will be exposed. And what I have seen in practice is that it'll just kind of dangle here at the IV pole, and then the risk that we take is that this is exposed. Somebody is going to bump up against it, it's going to go against the tubing. Either way, there's a high risk it can get contaminated. So you should never leave an IV Luer lock exposed like that. And what you can do is there are these nice and nifty tools here that's called a universal male to female Luer Lock Cap. So what we'll do, they come sterilely wrapped, and we'll go ahead and unwrap that. And of course, we'll be very careful not to touch that, and we can put the cap on our Luer lock and therefore make sure that it doesn't get contaminated, because now the inside of the locking mechanism and the surface area are protected.